Let's talk about obesity, particularly morbid central obesity. This can cause a pattern of extrinsic restrictive pulmonary function tests. The most common indicator of obesity-related disease is a reduction in expiratory reserve volume and functional residual capacity, but forced expiratory volume in 1 second, forced vital capacity, and total lung capacity are also typically decreased. Thiamine deficiency causes beriberi and Wernicke-Korsakoff syndrome. Dry beriberi is characterized by symmetrical peripheral neuropathy. Wet beriberi includes the addition of high-output congestive heart failure. Differential clubbing and cyanosis without blood pressure or pulse discrepancy are pathognomonic for a large patent ductus arteriosus complicated by Eisenmenger syndrome, which is reversal of shunt flow from left to right to left. Severe coarctation of the aorta can cause lower extremity cyanosis. Right to left shunting in patients with large septal defects and tetralogy of Fallot results in whole body cyanosis. Let's talk about aromatase. Remember that aromatase converts androgens into estrogens in the ovaries, testes, placenta, and other peripheral tissues. Placental aromatase deficiency causes accumulation of androgens during pregnancy, resulting in ambiguous external genitalia in female infants and maternal virilization. Let's talk about ependymomas. Ependymomas originate from the ependymal cells that line the ventricular system and the central canal of the spinal cord. Ventricular ependymomas can block the flow of cerebrospinal fluid through the interventricular foramina, causing signs of increased intracranial pressure, for example, headache, papilledema, due to obstructive, non-communicating hydrocephalus. Let's talk about digoxin toxicity. This presents with nonspecific gastrointestinal, for example, anorexia, nausea, vomiting, and neurologic, for example, fatigue, confusion, weakness, symptoms. Changes in color vision are a more specific but rarer finding, and life-threatening ventricular arrhythmias are the most serious complication of digoxin toxicity. Okay, and continuing on, the phase 4 slow depolarization in cardiac pacemaker cells occurs due to the closure of repolarizing potassium channels, the slow influx of sodium through Funny channels, and the opening of T-type calcium channels. Acetylcholine and adenosine reduce the rate of spontaneous depolarization in cardiac pacemaker cells by prolonging phase 4. So that was phase 4, slow depolarization in cardiac pacemaker cells. Okay, think about atrial fibrillation. This is associated with an increased risk of systemic thromboembolism. The left atrial appendage is the most common site of thrombus formation. Okay, cough. Cough is a very well recognized side effect of ACE inhibitor therapy. Cough secondary to ACE inhibitor therapy is characterized as dry, non-productive, and persistent. The mechanism behind ACE inhibitor-induced cough is accumulation of bradykinin, substance P, or prostaglandins. Because angiotensin receptor blockers, or ARBs, do not affect ACE activity, they theoretically should not cause a cough. Anorexia nervosa is characterized by a distorted body image and fear of weight gain despite significantly low body weight. Patients may restrict their food intake and or binge and purge. The key in distinguishing anorexia nervosa from bulimia nervosa is abnormally low body weight. Hepatitis A virus infection is most commonly silent or subclinical, and this is called anecteric in young children, but can also present as an acute, self-limited illness characterized by jaundice, malaise, fatigue, anorexia, nausea, vomiting, right upper quadrant pain, or an aversion to smoking. That's hepatitis A virus infection. Okay, let's talk about Histoplasma capsulatum. This is a dimorphic fungus that exists in a small ovoid yeast at tissue temperatures. It replicates within macrophages and spreads through the lymphatic and reticuloendothelial system. Immunocompetent patients usually have an asymptomatic pulmonary infection, but those who are immunocompromised, for example, advanced AIDS, can develop disseminated disease to the liver, spleen, and bone marrow. Right ventricular infarction or right-sided heart failure can lead to shock via impaired forward blood flow to the left heart, which lowers left-sided preload, which is decreased pulmonary capillary wedge pressure, and decreases cardiac output. The reduced right ventricular output also raises right atrial and central venous pressure. What is radial head subluxation? This is also known as a nursemaid's elbow. This is the displacement of the annular ligament into the radiohumeral joint, classically resulting from sudden axial traction, for example, pulling on the arm of a child's age, which is less than 5, so a child of less than 5. Although most patients do not have any obvious swelling or deformity, they avoid moving the arm due to pain and hold it with the elbow flexed and forearm pronated. That is radial head subluxation. Okay, we're going to talk about the basics of ACE inhibitors again, just as a review. Remember that they block the conversion of angiotensin 1 to angiotensin 2, thereby reducing vasoconstriction and aldosterone secretion. Decreased aldosterone leads to potassium retention, which can cause hyperkalemia, especially in patients with renal insufficiency. I'll read that again. We're talking about when there is decreased aldosterone. This leads to potassium retention, which can cause hyperkalemia, especially in patients with renal insufficiency and in those taking other medications that raise potassium levels, for example, angiotensin 2 receptor blockers, mineralocorticoid receptor blockers. Both of those. Clostridium difficile. Remember that? It requires additional contact precautions, especially hand washing with soap and water, a gown for any patient contact, and non-sterile gloves that should be changed after contact with contaminated secretions. And alcohol-based hand sanitizers do not kill the bacterial spores. Okay, and continuing on, let's talk about alpha-adrenergic agonists. These increase systolic and diastolic blood pressure by stimulating alpha-1 adrenoreceptors in the vascular walls, causing vasoconstriction. The elevated systemic blood pressure then causes a reflexive increase in vagal tone, resulting in decreased heart rate and slowed atrioventricular node conduction. Do you know what babesiosis is? Remember that babesiosis and Lyme disease are transmitted by the Ixodes tick and occur in similar geographic regions. So remember that co-infection is common with babesiosis and Lyme disease. Okay, do you know what Strongyloides stercoralis is? Strongyloides stercoralis infection begins following skin penetration by filariform or infectious larvae and can be diagnosed by finding rabiditiform or non-infectious larvae in the stool. Rabiditiform larvae can mature into filariform larvae in the human gastrointestinal tract, precipitating an auto-infection cycle that occurs entirely within the affected individual. This can result in a hyperinfection syndrome characterized by massive dissemination of the organism, leading to multi-organ dysfunction and septic shock. So that was Strongyloides stercoralis. The spinal accessory nerve is vulnerable to injury in the posterior triangle of the neck. Injury results in weakness of the trapezius muscle, which presents with drooping of the shoulder, impaired abduction of the arm above 100 degrees, and lateral displacement of the scapula. So that is the spinal accessory nerve. Intraductal papilloma is a proliferation of papillary cells in a cyst wall or duct that may contain focal atypia. It is the most common cause of bloody nipple discharge and typically presents without breast masses or skin changes. So that is intraductal papilloma. Do you know what cytokeratin is? Cytokeratin is a commonly used immunohistochemical marker of epithelial cell carcinomas. Mitochondrial vacuolization is typically a sign of irreversible cell injury, signifying that the involved mitochondria are permanently unable to generate ATP. So that was mitochondrial vacuolization. Reperfusion injury is thought to occur secondary to oxygen-free radical generation, mitochondrial damage, and inflammation. A single sarcomere is defined as the distance between two Z lines. Thin actin filaments in the I band are bound to structural proteins at the Z line, whereas thick myosin filaments in the A band are bound to structural proteins at the M line. Let's talk about osteocytes. Remember that osteocytes have long intracanalicular processes that extend through the ossified bone matrix. These cytoplasmic processes send signals to and exchange nutrients and waste products with the osteocytes within neighboring lamellae via gap junctions. Osteocytes can sense mechanical stresses and send signals to modulate the activity of surface osteoblasts, thereby helping to regulate bony remodeling. Parents with Müllerian aplasia, for example, Mayer-Rokitansky or Custer-Hauser syndrome, have no upper vagina. We've talked about this before. For example, a short vagina and variable uterine development. These patients are 46XX females with normal ovaries and secondary sexual characteristics. Okay, do you remember the class 4 antiarrhythmics? For example, verapamil and diltiazem. Class 4 antiarrhythmics, for example, verapamil or diltiazem, are commonly used to prevent recurrent nodal arrhythmias, for example, paroxysmal supraventricular tachycardia. They work by blocking calcium channels in slow-response cardiac tissues, slowing phase 4 or spontaneous depolarization and phase 0, which is the upstroke. This reduces impulse conduction velocity in the sinoatrial and atrioventricular nodes. So thanks very much for joining me on Med School Radio for another one of these episodes where we look at some of the summaries. And I recommend that you do this yourself to read over these objectives and summaries so that you can remember the details for your USMLE. Thank you very much.